Good morning. My name is Dr. Melody Keith. We're here in beautiful Lakeway, Texas, outside of Austin, Texas. And today, our Snapinar, we are going to talk about ankle issues, foot and ankle issues. Sorry, I just saw hip patients and my mind was on hip. So, with ankle issues are very, very complicated. Okay, you can have anything from, just a foot and ankle great toe issue like a bunion. You can have actually a strained sprain of the ligaments, and there's ligaments in the back of the foot, there's ligaments in the midfoot, and then there's ligaments in the front of the foot. So it just depends on what is going on with the foot. So what I want to do today is, number one, just explain to you that the foot is complicated, and you have to be able to get a very good analysis of what is going on in the foot and ankle complex in order to help what is ailing you in your foot and ankle. The first thing I can tell you is get a good pair of shoes, right? And we're not going to go into all of the different aspects of shoes, but get something that's comfortable and that supports your foot. Okay, we all love flip-flops. I do too. We're in the summer, but guess what? When you're walking, when you're moving, you need supportive shoes, right? So then I'm going to give you 3 ideas of exercises. Again, if these exercises hurt or you don't really understand them, please feel free to come on in. We would love to see you for your foot and ankle issues here at Lakeway Aquatic Physical Therapy. Also, if you have any other issues where you're not even walking on it, you're in a boot or anything like that, guess what? We can put you in the pool, and then you can go non-weight bearing and still exercise while whatever is going on in your foot and ankle heal. Okay? So, our first exercise, one that I love, little Tolly's going to show you. This is what we call our anchor 4-way. And you've all seen them, right? If you've had ankle issues, you're using a TheraBand, a little stretchy band, and you're going up and down, right? Up and down. What we want to make sure is that the foot tracks correctly. So when you're doing this, if your foot starts tracking, like incorrectly and moving kind of middle, see how it's kind of moving to the side or whatever, that's not correct. You've got to stabilize it. Okay, then I'm going to take it to the other side. We're just going to show you this because it is a 4-way ankle. So I'm going to here. Normally people would just tie it in, and she's coming up. And what we're looking for is proper tracking of the foot and ankle. Don't pull your toes back. Just pull the foot back. Think foot and ankle, not the knee. Okay? The other one we're going to show you. Yep, and see how she pulls her foot up? So we keep the foot in a nice alignment here. Super duper important. Try not to roll the leg. Try to just move the ankle. See how she wants to move her toesies? She's fighting this one. She's weak. Okay. So, and then the next one. Yep. She's got this. Check. There you go. Thanks. And back into the opposite side. Now it's moving to the mid side. And again, we're still trying to keep just the ankle moving in the proper plane, so it's not twisting and turning, and you're not flipping your toesies around. Very easily done. Right? And hold. There, she's got it. Great. Our next one. Miss Amy's going to show you marbles. So marbles helps with the long toe flexors and what we call our toe intrinsics. It gets the foot strong and stable. That's what makes the foot and ankle so complicated, is that it has to be a stable force. It has to be stable, but it has to be mobile, and then it has to be strong on top of it. So what the marbles does, it allows you to work both moving the foot side to side. As you can tell, she's picking them up. And again, she's not twisting her foot around. She's keeping her toes and then moving the foot out. See how she anchors the ankle, the foot and ankle into the floor? And then she's going to bring them all back in. Yep. She's like, I can do it. Yay. She's playing marbles. Yep. Yep. And she's trying to keep her foot flat, not letting it twist and roll to the side. Okay? And now we come into Miss Diane. And Diane is actually a patient here. And so she's going to demonstrate. This is our midfoot. So if you have midfoot issues, arch, pes planus, you have Achilles tendonitis, you also have any type of things, issues on the bottom of the foot and into the foot, where they call it plantar fasciitis, okay, which is broad encompassing diagnoses. So she's putting the weight into the arch of the bolster. This is just a half bolster here. You can use a noodle. Use a noodle, pool noodle, right? And then try to go in and out too, Miss Diane. Yep. And out. And then roll it out and in this way, yes. And again, she's utilizing the bolster to keep the weight into the midfoot. So you're kind of putting the weight on, almost as if you were standing on that bolster to kind of get the weight right into that midfoot to help open up all those little joints into the midfoot. So these are 3 really great foot and ankle exercises if you have some soreness or something. And those of you that are having any kind of ankle issues, you might try these just to see what they do to kind of help, because they do help, right? Yeah.
Definitely.
Definitely. That was her answer, yes. Definitely. They do help. Just takes time, just takes patience. But we would love to see you here. If you have any other questions, please feel free to give us a call here. We can answer all your questions about physical therapy and about how to get in, insurance, whatever other questions you have. We'd love to help you. Thank you very much. Have a great day.